Hi there, and welcome to this video learning series on mental health topics for non-therapist professionals. My name is Lara Okoloko, and I'm a provider educator with the University of Washington's Addictions, Drug, and Alcohol Institute, where I support professionals like you working in behavioral health and substance use treatment. I'm also a clinical social worker with experience in both direct practice and teaching. I've worked on many interdisciplinary teams as a case manager, a medical social worker, and as a therapist, helping people and their families navigate substance use and mental health challenges. In this short video, we're going to talk about common mental health disorders that you're likely to encounter in your work. Let's get started. This video series is about exploring practice topics relevant to substance use disorder professionals, peer helpers, treatment navigators, healthcare providers, social workers, and all of us who might be working with people with substance use disorders but are not ourselves therapists. In today's video, we'll be discussing different types of mental health challenges that are really commonly experienced by people with substance use disorders. We'll be talking about the symptoms and treatment options. Whether you're new to this field or looking to deepen your understanding, this video should be a good place to start. As I said, we'll be talking about common mental health challenges. So let's first figure out what is common. Let's start by figuring out how common are substance use disorders. When we talk about how common a disorder is, what we typically are looking at is how many people are experiencing that disorder in the last year. When we take a look at that number for substance use disorders, we see that about 17% of the adult population has a substance use disorder in the United States in the last year. That includes almost 29 million people who've had an alcohol use disorder in the last year and 27 million people who have had a drug use disorder. Now let's compare that to anxiety disorders, one of the most common mental health challenges that Americans face. An estimated 19%, or about 1 in 5 US adults, had an anxiety disorder in the past year. This includes all anxiety disorders, including panic disorder, generalized anxiety disorder, specific phobias, social anxiety disorder, and obsessive compulsive disorder. We'll talk more in detail about some of those things. Next, let's compare that to major depression. An estimated 8% of US adults had at least one major depressive episode in the last year. That's about 1 in 10. Next in this video, we're going to be talking more in detail about different personality disorders. This includes obsessive compulsive personality disorder, narcissistic personality disorder, and borderline personality disorder, amongst others. The prevalence of any personality disorder is about 9%, or almost 1 in 10. Now, let's dig in first to anxiety disorders, because this is the most common disorder that you're going to encounter in your clients and patients. Anxiety disorders affect about 1 in 5 adults in the United States every year. These include things like generalized anxiety disorder, panic, phobias, and obsessive compulsive disorder. People living with anxiety disorders often deal with excessive worry or intrusive thoughts that can really get in the way of daily life and prevent them from living fully. Someone with a panic disorder might experience sudden, intense feelings of fear or dread, sometimes seemingly out of nowhere. These panic disorders often come with strong physical symptoms, like a racing heart or shortness of breath. It can feel like something is seriously wrong medically. They might even think, I'm having a heart attack, even though it's anxiety. A really important thing to keep in mind is that for something to be considered a disorder, the symptoms don't just show up every once in a while. They tend to be persistent, and they cause distress or get in the way of how someone wants to live their life. We all feel worried or anxious sometimes. That's just a part of being human. But with anxiety disorders, it's more than that. It's about how much these symptoms interfere with a person's ability to function or feel okay. It's also common to hear people use diagnostic terms casually to describe preferences or personality quirks. For example, someone might say that they like to keep their home super tidy because they're so OCD about it, But unless those behaviors are causing distress or impairment, that doesn't necessarily mean the person has an OCD diagnosis. So it's good to be mindful about how we use those terms, especially as we're all becoming more informed about mental health. Now let's talk a bit about medications that are often used to treat anxiety, specifically SSRIs and SNRIs. These are commonly prescribed and considered first-line treatments for conditions like generalized anxiety disorder. But what do these acronyms mean? SSRI stands for Selective Serotonin Reuptake Inhibitor. SNRI stands for Serotonin and Norepinephrine Reuptake Inhibitor. These are called reuptake inhibitors because they prevent the reuptake of certain chemical neurotransmitters. These are cell messengers in the brain. Basically, these medications work by keeping the brain chemicals like serotonin and norepinephrine available longer in the brain, which can help improve mood and reduce anxiety over time. You might know these better by their name brands. Common SSRIs include Celexa, Lexapro, Prozac, and Zoloft. Common SNRIs include Cymbalta and Effexor. Research shows that these medications have small to medium effect size when compared to placebo, but they can make a meaningful difference for a lot of people. When it comes to talk therapy, cognitive behavioral therapy is a strong evidence-based choice for anxiety. CBT, cognitive behavioral therapy, focuses on helping people recognize and interrupt unhelpful thoughts and behaviors that feed their anxiety. It's very practical and skills-based. Another approach you might hear about is ERP, or exposure and response prevention, very useful for treating OCD. This involves gradually and safely exposing someone to a feared situation, like touching something perceived as dirty, and then helping them to resist the urge to do their usual ritual, like hand washing. It can be uncomfortable at first, but over time, the anxiety does tend to decrease. For kids and teens with anxiety or OCD, there's also a program called SPACE, which stands for Supportive Parenting for Anxious Childhood Emotions. This is a parent-based treatment that teaches caregivers how to support their child's recovery. The great thing is that it works even if the child doesn't participate in therapy, just by helping the family change their responses. And finally, one of the most important things to know is that the most important indicator of effectiveness for talk therapy is when the client feels both understood and cared about by the therapist. This is likely one of the best predictors of positive outcomes, even more than the type of therapy that's used. Now let's talk about mood disorders. These are conditions that mainly affect a person's emotional state, like depression. Mood disorders can make day-to-day life feel really hard, but with the right support, people can manage their symptoms and live full and meaningful lives. Depression is not about just feeling sad once in a while. Depression's more than that. It can show up as persistent low mood, a loss of interest or enjoyment in things that used to feel good, and it lasts at least 2 weeks. It can also affect things like sleep and appetite and especially energy levels. It's also really common for people with depression to have upsetting critical thoughts about themselves when they're really struggling with depression. The good news is that treatment does help. Many people start to feel better with therapy, medication, or a combination of both. According to the American College of Physicians, first-line treatments like cognitive behavioral therapy and antidepressant medications like SSRIs or SNRIs, which we discussed in the last slide about anxiety, work well for depression. Sometimes the first medication doesn't quite do the trick, and people might need to work with their doctor or a psychiatrist to try a different medication, adjust the dose, or combine medications to find something that works. That's totally normal, and it's often a process to find the right fit. The most important thing to remember is that improvements in symptoms is possible, and with the right tools and support, people can absolutely feel better and reconnect with what matters most in their lives. Bipolar disorder is another kind of mood disorder. This is characterized by significant changes in mood and energy. People with bipolar disorder experience both depressive episodes, like we just discussed in the previous slides, but But they also experience periods of mania or hypomania, a less severe form. During manic episodes, people experience a big upswing in energy that might lead them to be feeling very excited or irritable. You might notice someone talking very fast or sleeping very little. In the rise into mania, people might be feeling very happy, creative, productive. However, mania continues to ride right past this into a state that can include impulsivity, racing disorganized thoughts, a feeling of spinning out of control, and a symptom called grandiosity, in which people might feel like they're superior, famous, or invincible. The symptoms of mania are observable to other people and can cause significant problems in people's lives, including dangerous behaviors. It's important to note that mood swings are very common in kids and teenagers and don't necessarily point to a bipolar disorder. Adolescents who develop bipolar disorder have symptoms that cause significant problems at school, with friends, at home. Mood swings could also be a symptom of ADHD or anxiety, and extreme mood swings can also be caused by someone's pattern of substance use. So, an experienced clinician will need to do a thorough assessment to see if a bipolar disorder diagnosis is the best explanation for the patient's symptoms. Next, let's talk about common personality disorders. I want to start by saying personality disorders tend to be highly stigmatized. As providers, we should avoid using personality disorders as labels or put downs. This can actually increase stigma and lead to poor treatment for people with personality disorders. Each person is a unique individual, but people with borderline personality disorder tend to have certain personality traits in common with each other. Let's look at a few of them. One of those main traits is an unstable sense of self. But what does that mean exactly? People with a stable sense of self feel confident in who they are and know how to easily be themselves, even across different settings and contexts. People with a more unstable sense of self may feel like a chameleon, so much so that they lose their sense of who they are, really at their core. This can make people feel empty or unstable inside, and it can lead people to feel like they don't know who they are anymore if they have a breakup or they lose a job and they don't have that context anymore. You can imagine that this could lead to a really intense fear of abandonment as they strive to keep their relationships in place, in part to keep their sense of themselves in place in that relationship. They might ask themselves, who am I without this person? Or who am I without this job? People with borderline personality disorder may also be very attuned to the feelings of other people. They can be very intuitive and have deep empathy for people and animals. They can also be creative and passionate people. On the other hand, they might be prone to mood swings and impulsive behavior, including self-harm and suicidal behavior. All of this can lead people with borderline personality disorder to have very hot and cold relationships, getting close quickly with people, and when things get too intense too quickly, leading to breakups or cut off. People with borderline personality disorder can make changes in their lives to increase stability and cope with big feelings. The gold standard treatment for borderline personality disorder is dialectical behavioral therapy. DBT helps people work both on acceptance and change, work on skills such as mindful self-awareness, self-acceptance, relationship skills, and distress tolerance. Next, let's talk about obsessive compulsive personality disorder. This condition shows up as a strong need for order, control, and perfectionism, so much so that it can actually get in the way of a person's ability to function in everyday life. Someone with obsessive compulsive personality disorder might be very self-critical or indecisive because they want things to be perfect. That perfectionism doesn't motivate them, though, in a healthy way. It actually can stop them from finishing tasks or making decisions at all. Also, relationships can be tough because people with obsessive compulsive personality disorder might struggle with being flexible. They might have really specific expectations for others or try to control situations in order to feel safe or in charge. Now, it's important to remember that there's a wide range of human behavior, and not everyone who's detail-oriented or organized has a disorder. What makes something a mental health condition is when the behavior causes distress or impairment, when it's getting in the way of someone's ability to enjoy life or connect with other people. Let's consider an example. One person might call themselves a perfectionist because they love doing a good job, but that's not necessarily a problem. But with obsessive compulsive personality disorder, perfectionism might be keeping someone from finishing a project because it never feels good enough. Or let's say someone creates a detailed itinerary for a family trip. That might be helpful. I too love a good spreadsheet. But someone with obsessive compulsive personality disorder might become so rigid and preoccupied with the schedule and the rules that they can't relax and enjoy the vacation at all. So when we think about these kinds of behaviors, it's helpful to ask, is this working for this person? Is it helping, or is it getting in the way of the life that they want to live? That can help us better understand whether it's a personality style or something more, like a personality disorder. Now let's take a look at narcissistic personality disorder. This is a complex condition. It deeply affects how someone sees themselves, how they relate to others, and how they handle emotions. These days, the word narcissist gets thrown around a lot, especially online. And while it's great that people are more aware of emotional health and harmful relationship patterns, it's also important to be careful. Just because someone's difficult or frustrating or even acting in a hurtful way, that doesn't necessarily mean they have narcissistic personality disorder. Narcissistic traits are different from a personality disorder, and a clinical diagnosis depends on an assessment by a mental health professional. We can't diagnose our own family members, our colleagues, or even celebrities. People with narcissistic personality disorder often struggle with grandiosity and defensiveness. They might seem very confident or even superior on the outside, but underneath that's often a deep avoidance of vulnerability. This makes it really hard for them to admit when something's wrong or ask for help. So when it comes to therapy, just getting started can be a challenge because opening up about struggles might feel threatening or shameful, or they might be quite good at not seeing their part in any of their problems. That said, many people with narcissistic personality disorder do come to therapy and other behavioral health services, often for things like depression, anxiety, or substance use. In those cases, it's helpful to start with standard treatment approaches, like therapy or medication, while keeping in mind that progress just might be slower or more complex. Some of the same issues that get in the way of their personal relationships might also pose a challenge to the therapy relationship, and that's totally okay. It's part of the process, and an experienced therapist will be aware of these challenges. There's no one perfect therapy method for narcissistic personality disorder that works for everyone, but building a strong, trusting relationship with their provider is a key across all approaches. Creating a space where someone feels respected without reinforcing or validating the harmful patterns they may find themselves in is one of the most helpful things that we can do. Let's talk a bit more about how narcissistic traits show up in everyday life. People with this disorder often define themselves through how others see them. Their self-esteem can swing wildly, one minute feeling on top of the world and the next minute deeply insecure. Imagine if your self-esteem was dependent only on the opinions of other people. This really leaves you vulnerable to big ups and downs. Their personal goals might be more about earning admiration than about cultivating connections with others or feeling satisfied with their own work. Sometimes they might hold themselves to impossibly high standards, or the opposite, they might feel entitled to admiration without putting in much effort. This can look like grandiosity, that sense of being more important or special than everybody else, and expecting others to agree. People with narcissistic personality disorder might stand out too for their attention seeking, as they might really need to be admired or praised in order to feel good about themselves. With empathy and relationships, they might have trouble truly understanding how others feel. While they're often very attuned into how other people are reacting to them, it can be harder to take someone else's perspective or understand their impact on others. There might be very little curiosity about the other person's experiences unless it somehow reflects on them. They might find that their relationships feel transactional and lack emotional intimacy because intimacy requires vulnerability. Understanding this disorder is not about judgment, it's about compassion, clear boundaries, and realistic expectations. These are real challenges, sometimes rooted in early life experiences and learned patterns of coping. And with the right support, people can experience personal growth, healing, and build more meaningful connections. With all of the disorders we talked about today, it can be difficult to tell the difference between symptoms of substance use and mental health symptoms, especially while someone is still using alcohol or other drugs. But telling the difference can be really important for helping someone get the right treatment or try the right medication. Even the most experienced providers can find it impossible to tell if the symptom is related to substance use or an underlying mental health condition. Paranoia, irritability, mania, these are all things that people might experience because of a core mental health disorder or because of their substance use, or both. We might need to observe times of abstinence to really confirm a diagnosis. Thanks for watching today's video about common mental health disorders. I hope this will be helpful to you in your work. Please return to watch other videos in this series for behavioral health professionals who are not therapists. And thank you for the work that you're doing to support people with substance use disorders as part of your multidisciplinary team.